So this exercise, Catherine, is steps exercise. And really what, we use it generally for, say, children and teenagers, but also, of course, for relatively healthy adults. So even though if they've got a relatively low CP, it might be 15, 20 seconds, the steps is a very good exercise to help challenge the person. And it's also very good for, relieving symptoms. For example, if they felt that, yes, their nose is a little bit blocked, they can decongest their nose doing this, and it helps to ensure quicker progress. So you have an adult, for example, who is doing the reduced breathing. They may also do some walking with breath holds or do steps just to speed up progress a little bit. This is the main exercise for children and for teenagers. So it involves taking a small breath in through your nose and a small breath out through your nose, and then you pinch your nose. You hold your breath until you feel a medium to strong air shortage. And then when you feel, you really need to breathe in, then let go of your nose, breathe through your nose, calm your breathing, and walk a few paces and then recover. So I'll explain it to you again. You take a small breath in through your nose, a small breath out through your nose, you pinch your nose, and you can start walking. Now, you can go easy enough for the first one, actually. Go easy enough for the first, and even increase the pace. And when the air shortage gets a little bit stronger, go faster. So I suggest now go faster, walk faster, and now let go of your nose and resume breathing. Excellent. And just walk a few paces to recover. Walk a few paces to recover. And now you can take a rest. So for the first couple, I always tend to go easy because I can kind of condition you to it. So you rest then for about a minute or so. Now, with this, we always kind of record progress. So for children, we count each step that they're taking, and we document that in their diary. So we evaluate their measurement. This is a measurement of progress for children, in that we expect a child or a teenager to be reaching an extra 10 every week. And the ultimate goal is, of course, 80 to 100 paces. So, at that point then, when their steps are 80 to 100 paces, they'll find that their sleep is better, energy levels are better, breathing is better, ability to tolerate physical exercise is better. Asthma symptoms, of course, will be non-existent. Even if they're subject to a trigger, it's highly unlikely that they'll get symptoms. So again, you've rested for about a minute or so. So now what I'd like you to do is, again, take a small breath in through your nose, a small breath out through your nose, pinch your nose, and start walking. And you can walk and relax into your body as you're walking. And when you feel that the air shortage is getting a little bit stronger, increase the pace. Now, increase the pace, and keep walking, keep relaxing into your body. You'll feel your diaphragm spasm. When you find the air shortage is quite strong, let go of your nose, breathe through your nose, calm your breathing, excellent, and now walk just a few paces to recover. So it's quite an intense exercise, and now just walk a few paces to recover. And again, you should always recover within 1 to 2 breaths. Ideally, you cover within, say, 2 breaths or so. So you can just walk 1 lap, and then we take a rest in that, and then we wait a minute again. So we take a minute. So Catherine, after about a minute's rest or so, again, when you feel comfortable and your breathing is recovered, whenever you're ready, take a small breath in through your nose, small breath out through your nose, pinch your nose, and hold your breath. So if you'd like to start, small breath in through your nose, small breath out, pinch your nose, and start walking. Now, as you're holding your breath, nitric oxide is, of course, pooling in the nasal cavity. And so you keep on holding your breath, keep walking until you feel a fairly strong air shortage. When you really need to breathe in, let go of your nose and inhale that nitric oxide laden air into the lungs. So you get the benefit. And now, of course, to allow your breathing to recover back to normal. So just to walk a few paces then to recover. So we're going to do it 3 more times. So again, just allowing your breathing to relax, and then you can take a rest. Allow your breathing to recover. So there's a number of things that are happening when we hold our breath. When we hold our breath like that, we are dropping oxygen saturation in the blood. A second effect to that is that as we hold our, after breathing in and breathing out and holding, carbon dioxide accumulates in the blood, so it's giving us what's called a hypercapnic response. And the third aspect is nitric oxide. So it's a very, very useful exercise for, say, somebody involved with sports. But of course, it's also useful exercise in terms of health, provided the person doesn't have cardiovascular issues or type 1 diabetes or any kind of serious health, conditions. We don't encourage doing this because it is an intense exercise. So I'd like you to try it again. Take a small breath in through your nose, small breath out through your nose, pinch your nose with your fingers, relax into your body and start walking. And when you feel, say, a medium to strong air hunger, is to start walking faster. So during now is just keep relaxing into your body. Start walking faster, start walking faster, start walking faster. Relax into your body, and when you feel a strong air short, let go, resume breathing and calm your breathing back to normal. So just allow your breathing now to recover. Do you feel okay? Mm-hmm. Great. So just allow your breathing to recover. And then you can take a rest at that. So Catherine, we use the steps as a measurement of progress with children and teenagers, and we're counting the steps, we chart our progress, and it allows parents, and of course myself as well, to see the progress of the child, that we would expect then that the steps are increasing incrementally each week or whatever. The reason that we use the steps as a measurement of progress is because it can be quite difficult for children to understand the control pause. And it can also be quite difficult for children to understand reduced breathing. So we give them the concept of reduced breathing. We teach them that their breathing should be light, it should be calm, it should be gentle. And this then is their main exercise. So for children, this is the main exercise, and for adults, it's kind of a supplementary exercise, that the reduced breathing is the main exercise. So whenever you're ready, I'd like you to do your final steps. So again, small breath in through your nose, small breath out, pinch your nose, relax into your body. And as you're holding your breath, continue bringing a feeling of relaxation to the body. And at some point you will feel your diaphragm start to spasm. Continue bringing a feeling of relaxation. And when you feel that the air shortage is medium to strong, increase the pace. So if you start walking faster, so you're walking through the air shortage. Increase the pace, keep on increasing the pace. And when you feel a strong air shortage, let go of your nose, breathe through your nose, calm your breathing, and continue walking. Excellent, that's great. And now allow your breathing to go back down to normal. Allow your breathing to recover. So just allow your breathing to recover. Following your breath, bring a feeling of relaxation to the body. And then that's pretty much, so you're finished with that exercise. So we do about 5 to 6 repetitions of steps. And we do that, say, in the morning. You could do it in the afternoon. You could do it in the evening. And that's pretty much it, I always suggest to people, start off a little bit easier for the first couple, and then just gently build yourself up to it. So great.